Okay, so we've come together to have a conversation, Jackie, relating to our Heads Together that the Trust has signed up to around breaking down stigma around mental health needs. And as you know, 1 in 4 adults suffer with a mental health problem across the UK, and 9 out of the 10 people who suffer with a mental health problem also face stigma and experience stigma, and we really want to break that down. So it's important that we have a conversation around that at our level of the organisation. So it might be interesting if we discuss around how we maintain our own mental health and our own mental health well-being around some of that. So how do you keep going?
Gosh, that's a good question, isn't it? And you know, what strikes me is it doesn't matter whether you're a chief executive, you know, whether you're a nurse or a porter, you know, it's so fundamental for us all to maintain good mental health, because without good mental health, there is no health and well-being. So the way I do it, I mean, I know myself really well, so I think it's really important to know when you are feeling stressed and imbalanced, and you know, so I've now got a pretty good sense of what my day will be like. And one of the things I do is building what I call restorative niches. And they might be at lunchtime, so I might go out for a little walk if I'm feeling a bit stressed and a bit, you know, a bit anxious about something. I might go to the gym after work if I know it's been, you know, I just need to get some frustration out of the way and, you know, drop my blood pressure down a few notches. Or it might just be a walk by myself, or a bubble bath, or, you know, lots of ways to just get the balance and get the awareness of what's really going on, and how I respond to it. Right. What about you?
I do very similar things. So I had a crisis a few years ago, and I really learned that I need to look after myself. And I went through a period of depression, and that's where I started to find cycling and the gym. So I take it out on the road, or I take it out on the treadmill, and that has really helped me over the last few years to really sort of keep myself going and build that resilience back up that we all need in our roles, I think, to keep us going and keep us focused on ourselves and on
and
what
Paul, did you find at the time, did you talk about that? Because one of the problems we've got is that people think this, you know, that everybody suffers in some way or another. So
it was a time in my life when things were quite difficult at the time, and it was my mother-in-law who actually said, "There's something up with you," because I didn't talk, and I didn't talk to anybody about anything, so I just sat in a corner. And it wasn't until my mother-in-law said that I thought, oh, I better go and do something now. And you know, I went and got help and had that conversation, and everything's been fine ever since. Because I now know the importance of having that conversation and being able to admit, actually, that, you know, at times we all get a wobble, and we all need to sort of re-energise and refresh, and being able to talk openly about that is key. And you've been